Hi there, my name is Carlo Renato, chiropractor and PhD candidate from Sydney, Australia. Well, this is now another video that I'm going to be presenting on the content that we're going to be covering in our upcoming August 4-5 seminar in Hong Kong titled Managing the Cervicogenic Patient. Keep in mind that this seminar is very much geared for chiropractors and physiotherapists and similar professions, those that really want to upskill their understanding and competency in managing patients with cervicogenic disorders. And they include people like chronic pain patients, degenerative joint dysfunction patients, whiplash patients, concussion patients, people that have cervicogenic dizziness, people that have unexplained balance problems, a lot of which comes from the cervical spine. And whilst I'm not taking away from our manual therapies, I really want to increase clinicians' competency and understanding and how the spine, particularly the cervical spine, interacts with the brain and how the brain interacts with the spine and the body. And we're going to put away some of the outdated models of why things happen and look at the clinical neuroscience. And there's plenty out there that can support what we do as clinicians. We just need to keep updated with this. And really that's the goal of this seminar. So I certainly hope that you can join us August 4-5 in Hong Kong. This particular talk now, I'm going to cover some of the oculomotor aspects that we're going to be spending and covering in the 1.5 days that we have planned. So just to recap, some of the topics that we're going to be covering is starting off with the foundation, how areas of the body, in particular the cervical spine, are connected to the brain and how the brain is connected to parts of the cervical spine. And we need to move away from some of those outdated models and really look at where the science is telling us. And there's plenty out there. We don't have to make things up. It's there, and I'm going to share that with you. So a lot of the work that I'm going to be covering are referenced, so you can use that at any time you want to in having discussions with any of the practitioners that you may associate with. So we're going to talk about cervical joint dysfunction, assessment and management, a very practical approach, how to assess and to really help a lot of these patients that have cervicogenic problems. And we're going to put together some nice cases that are going to help you as well. So today we're going to look at the oculomotor aspects. And if you've been in practice for more than a week and you manage someone with a cervical joint problem, on your intake form, you'll no doubt would have seen them ticking boxes like, I have problems reading at times. I get blurred vision. I have troubles keeping focus on something when I read or when I move. Well, one of the reasons why is when that cervical spine is not working well, it connects to areas of the brain that control your eye movements. And when the cervical spine is not working well, that information is going to be distorted, and eye movements can also be distorted as well. So some of the things that we're going to be covering are some of the assessments, and we're going to look at one of the first tests that we're going to do is called the Smooth Pursuit Neck Torsion Test. You're going to see a lot of these names. Someone's come up with them, but nonetheless, this is what they are. We're going to look at how oculomotor function or the ability to pursue slowly and smoothly, for instance, words on a page or watching someone walk across your vision. That smooth pursuit is in some ways affected or controlled by what's happening in your cervical spine. So we're going to break down the neurophysiology behind it, but also the best way that we can assess that. And this test here helps us look at that cervicocolic reflex. And you can see in the chart there, you can see that's the cervical proprioceptors has a strong connection with our oculomotor nuclei that control some of this smooth pursuit. So, you know, it's exciting to see the reasons why and the neurophysiology of what exactly we see in practice. Because you'll see this, but now you're going to have greater clarity and competency in being able to identify as well as manage these patients as well. Okay, and if you ever want to explain to a medical doctor that this adjustment or this treatment that I'm going to do on someone's cervical spine is going to help their vision, well, I'm going to show you references that you could use that you can simply quote, you could say, well, this is what happens when you have a joint dysfunction. You get abnormal oculomotor function. Here's the test that we're going to use to help detect it, and here's the treatment that's been shown to help mitigate or improve oculomotor function. That's pretty cool. And we're going to go on other tests that look at how we control the cervical spine and how it affects our eye movement. So stay tuned for that one as well. And finally, before we finish up now, we've got our sort of promotion slide that talks about what we're going to be covering, so you can see it in greater detail. You can see with the location. You can see the relatively small cost of this seminar. Just to let you know, our fees in Sydney, in Australia, are probably anywhere between 25 to 33% more than what you guys are being charged in Hong Kong. So for me, you guys are getting a great offer and a great deal. I certainly hope to see as many of you guys as possible. We've got a relatively small room. It's not a huge room. I'm sure we're going to be sold out. Early bird closes the end of June, end of this month. We've already sold a handful of tickets, and so I expect us to sell out pretty quick. So my suggestion is just grab a few mates, come across to the centre, to the seminar room, and we'll look forward to seeing you guys then. Take care for now. Bye-bye.